Thank you so much for the free consultation. I really appreciate it. I do have a few questions before we potentially start this up, if you don't mind. Sure. All right, great. Do you feel like you have too many clients right now to reasonably manage and keep track of? It's confidential information. It just seems reasonable for me to ask if you have the capacity to see me. I'm seeing you right now, aren't I? Yeah, but never mind. Next question. You've advertised that you practice emotion-focused therapy, and I'm wondering if there's any resources you revisit or ways that you reinvest in that skill set. Okay, stop. I don't need this. Need what? This. What you're doing. Oh, these are literally the only 2 questions I have for you today. Oh. Normally I'd ask if you'd like to try that again, but that's reserved for friends and... That's fair. I'm gonna exit the call now. While we can hope that your next therapy consultation does not go this way, the questions asked here of the clinician are not unreasonable. Hello and welcome to WellMind Study, where we discuss all things therapy related. The topic of today's video is going to be what you should know before starting therapy. If you've got any experiences of your own you'd like to share about what consumers should know, please feel free to leave your thoughts in the comments section below after the jump. Starting us off with number 1, licensed versus unlicensed therapist. The prospect of working with a professional who is unlicensed can feel intimidating if you don't quite understand the difference between the two. When we're talking about licensed versus unlicensed, we're not talking about people who have no experiential or educational background in providing therapy, but the difference between a licensed and unlicensed provider isn't always super clear. The idea that a licensed provider is going to be superior to an unlicensed one just doesn't hold weight, and there's a few differentiating factors between the two. For starters, while a licensed provider may have more experience in actually providing therapy, they may also not have the time or motivation to keep up with newer developments in the field. This would stand in contrast to an unlicensed provider fresh out of graduate school who would have access to the most up-to-date information available on what could be helpful to their clients. If that doesn't convince you to try a clinician who may not have as much hands-on experience as a licensed provider, consider the 2005 study in the Journal of Clinical Psychology and Psychotherapy that purports there's no fundamental difference between the two unless you're accounting for someone who has a high degree of sustained experience and specialty working with certain issues such as OCD, anxiety, etc. The journal also notes that despite whatever specialty experience one might possess, it's a use it or lose it kind of deal, as the ability to attune to the needs of someone presenting for a specialized issue greatly diminishes after around the 75-day mark of not treating someone in that range. Further driving the point home, the APA states that the strength of the relationship is likely the biggest predictor of positive outcomes, noting a few more human variables that matter more, such as the therapist demonstrating flexibility, eliciting feedback, allowing processing of negative emotions, and being able to repair ruptures in relationships, to name a few. Unlicensed clinicians are also required to work under the supervision of licensed professionals as they accrue hours towards licensure. So while they may not have the years of experience under their belts as licensed clinicians do, you can rest assured that they're not practicing in isolation and are consistently getting feedback about how to help the people they're working with. 2, what certifications mean. How many times have you popped over to a clinician's website only to see a bevy of certifications you don't understand? Sifting through certifications can be challenging, including for myself, and here's why. As we've discussed, licensed versus unlicensed is one level of certification, but there are other certifications that clinicians can track into once they decide they want to specialize. But just because someone is certified in a specialty that you're looking for doesn't mean that it will necessarily make them a better therapist for you. With that out of the way, I'm going to review some certifications that matter to me and provide some examples of what and how to look for certifications that your therapist is advertising. One certification that I can safely say is pretty heavily monitored in terms of quality control comes from the Association for Play Therapy. They possess a certification track to become a registered play therapist that's pretty comprehensive. So I imagine a question that's likely coming to mind is, well, can a therapist practice using play therapy interventions without having that credential? The answer is yes. A therapist can pull from any number of theories without having specific credentials, but the credentials are there to communicate that there are specific standards of coursework and training that these providers have undergone in order to enrich their practice of these therapies. Additionally, some theoretical frameworks rely not just on education and experience, but also infrastructure such as dialectical behavioral therapy, or DBT for short. There are tons of profiles on multiple therapist directories where therapists claim to offer DBT therapy, and I will tell you right now, while I don't think they intend to lie, it is at least not totally honest for a good chunk of them. Many of these directories don't allow providers to differentiate between offering therapies where their interventions have been informed by a theoretical orientation versus actually being certified in that theoretical orientation to the extent that they can execute it to a specific degree of fidelity that's required by credentialing boards. For example, let's say I'm really theoretically aligned with DBT and want to incorporate DBT interventions into my practice. I can take a bunch of continuing education courses to learn about how to apply these interventions, but I will forever be limited by the fact that I myself alone in my private practice can't offer DBT. I can say that I offer DBT-informed interventions, but when it comes to what DBT treatment actually is, there's a lot of infrastructure I need to have in place beyond continuing education and even DBT certification. When I go to make my profile on a therapist directory, though, it'll ask me what theoretical orientations I offer, and I can select DBT without offering any proof that I'm actually competent or certified in that skill set, or even equipped with the infrastructure to be able to offer it. As you can imagine, this is intensely frustrating for many who do invest hundreds of thousands of dollars and tons of time jumping through hoops to get certified just to see another provider who took a 3-hour course touting their own certification, insinuating that they're the same thing. I digress here, but you can see where some of the issues here are starting to come from. To use myself as an example here, I absolutely love incorporating emotion-focused therapy techniques into my practice, use it extensively in couples therapy, and respect the work that the International Center for Excellence in Emotionally Focused Therapy has done to further it. That being said, I haven't gotten certified through the ICEEFT due to both the time commitment and expenses needed to undertake their certification process. That's not in any way to criticize them for the important work they do, but that is to say that short of certification through them, I need to hold myself accountable to reading or rereading EFT literature and taking at least, as a self-standard I have, at least 10 hours of continuing education courses per year to make sure that I'm feeling confident enough in my own skill set to be able to practice with a high enough level of fidelity. Chances are I'm likely going to get certified with them in the future because I'm an absolute fan of how EFT works, but I wouldn't misrepresent myself to say that the continuing education I have in this area is a substitute for the work I'd put in through the center. For more information about the important work they do, feel free to check out the links below. If you want to figure out if your provider is sufficiently certified to be offering the types of therapy they offer, feel free to visit some of the links below. The therapies I just listed are a few examples of theoretical orientations that either offer advanced training or pathways to certification to practice with a high level of fidelity. That being said, they're not exhaustive by any means. I also don't want to leave you all with the impression that just because someone isn't certified in a type of therapy they're pulling interventions from, that they're somehow ineffective or trying to pull one over on you. I'm giving you this information to help you, the consumer, make decisions about what kind of treatment you want so you can make the best decision for yourselves. 3, your clinician's caseload. This numbered item is going to be tricky to talk about. I myself came back to this over the course of 2 weeks and deciding whether or not I was going to say this, but I think it's important that I do. Generally speaking, the ideal private practice caseload has capacity for 15 to 25 clients, especially considering different treatment needs and severity. When I talk about a clinician's caseload, I'm talking about how many people clinicians see in a week. According to a study published in 2021 in Psychological Services, a correlation was observed between higher caseloads and outcomes. The correlation was small, but still significant enough for them to point out the fact that when clinicians have higher caseloads, it may make the quality of our work less impactful. Now, I know there's going to be some folks who leave with the impression that a caseload of 20 clients isn't high, but consider this: 20 clients a week averages out to 4 clients a day during a 5-day week. That's 4 clinical notes to write, 4 insurance companies to bill if the provider is accepting insurance, continuing education courses, which we can budget about an hour per week for, checking in on treatment planning and paperwork requirements weekly, and also client resourcing / tertiary paperwork that may be needed, such as letters for accommodations and other clinical tasks. I know I left some tasks out, but if you're a provider watching this, then feel free to fill in some of the blanks with where your time goes. The reason why this is tricky to talk about is because despite 15 to 25 being an ideal caseload, many therapists are often tasked with taking on more clients than we can reasonably expect to see due to the false belief that 1 client hour is going to equal 1 working hour. There are companies like the ones that even take up advertising space on my videos, which I don't have any control over, that will encourage or require clinicians to see far more than 25 clients in a week, with caseloads ranging from 35 to 60 clients and upper extremes going up to 80. Why? Well, money. Because whether it's a telehealth platform, insurance company, or venture capital funded startup, many therapists will often need to take on more clients than what's reasonable in order to eke out a sustainable living. As a response to this, one survey estimated that 42% of therapists in California did not accept private insurance at all. This also isn't limited to therapists in private practice as far as the mental health field is concerned, as according to CNBC, only 56% of psychiatric providers accepted commercial insurance, in contrast to the 90% of medical providers who accept it, who treat physical conditions in hospitals or their own private practices. I say all this to encourage folks to do their due diligence when selecting a provider, and hopefully not to have anyone walking away with the belief that just because their therapist accepts insurance that they're somehow compromised. This is something to be mindful of, however, but just know that if your provider is having to see 60 clients a week, this isn't something to hold against them. It's just more reflective of how valuable both insurance companies and venture-backed mental health startups see mental health services and the people who provide them. That wraps up our talk for today's video. Hopefully we've been able to be of some help today. If you have any comments, questions, concerns, please feel free to make your voice heard in the comments section below. Also consider tickling that like button, please, and also consider subscribing. I really hope you all have an awesome weekend, and thank you for joining us. I'll see you in 2 weeks.